Now, a lot of it is nothing more than just mumbo jumbo. Thank you for pausing to watch one of our videos. Today, we want to expand on the 4 cardinal rules of getting a job out of residency. And we want to talk about the end. We want to talk about the termination clause. A lot of times what we see is that new graduates are afraid, a little bit timid, when it comes to discussing the contract openly with a new employer, and especially discussing the part that talks about, well, the end. Now, in the ideal situation, your first job out of training is the one that you love, you sign with them, and you stay there forever, no matter what kind of practice it is. Unfortunately, experience shows otherwise. So you need to know how you can get out. Now, there are 2 possible situations, well, more than 2, but 2 broad categories, and it depends on where you live. If you live in a state that has a non-compete clause, you need to be very careful when you sign your first contract, and I strongly urge you to retain the help or advice of an attorney. And normally, those contracts are structured in a way where your employer specifies a certain mile radius inside of which you're not able to practice for a certain period of time if you were to leave employment of either your hospital or your group. They do that, of course, so that they can retain any kind of patient that you brought in, and you can understand that it's all business. However, you're the one who brought in that business, so you need to be well aware of that clause and see what you can do. Your attorney can help you, perhaps, to structure a contract in a way where there's certain provisions, if you complete certain things, or if the employer does not satisfy certain obligations, where you might be able to either narrow the radius or get rid of it altogether. This may not be possible, but at least you'll know exactly what you're getting into. And I urge you, please, not to sign anything on a dotted line before you retain the help of an attorney. Another situation is that you may live in a state that does not have a non-compete clause. It sounds great. However, a lot of those contracts put a little stipulation where they talk about patients that you've seen and how you are not allowed or how you should not take those patients with you. Now, a lot of it is just nothing more than just mumbo jumbo, because still the law is not even the law. It's the patient's right to choose any doctor he or she wants to see, and it's up to them if they want to follow you. The devil is in the details, and it's about you how to contact those patients and how you bring them with you should you choose to do so. Again, you need to review that clause with your attorney and have them specify any part, not any, but specify a certain situation that might arise under which you leave employment of your organization and you still take your patients with you. I keep talking about you retaining services of an attorney, and I understand how expensive it would be, but it's a small expense before you sign your contract, but I think it's going to last a lifetime. I think it's going to give you quite a bit of a guarantee or worry-free life when you know exactly what you're getting into. Again, please remember, you're the physician or you're the healthcare provider, and the organization needs you a lot more than you need them. So don't be afraid to ask about every specific detail of your contract. If you find this information useful, please share with your friends and colleagues. Thank you for watching. Would like you to join us for one of our 2 live webinars. Why is it important for you to join us? Well, because we're going to tell you how we're going to help you get a great position out of residency. Not so much helping you getting a job, but help you understand how to go about it and how to get a good deal. We're going to talk about the most pressing issues facing physicians and healthcare professionals at this time in our country, and how you can still have a successful practice despite all the pressing issues facing physicians. We're also going to talk to you about insurance reimbursement rates, and we're going to help navigate this very complicated world, and you'll be able to ask your questions live. Our webinars are completely free, and the goal is to help you decide and help you understand your future of practicing medicine.